Good morning, everyone. Thank you all for joining us on this first Purple Friday of the season. Before we get started, we'll just let everyone know that our Ravens will be victorious Monday night over the Los Angeles, Oakland, Las Vegas, whatever they're called these days. But we are here today with our Health Commissioner, Dr. Jaraja, and our Fire Chief, Niles Ford, and we're talking about COVID. And as our city continues to battle this pandemic and push more residents to get vaccinated, I am excited today to announce that the Baltimore City COVID-19 dashboard has gotten a bit of an update. As of this morning, members of the public now have the ability to access both COVID-19 metric dashboard and the vaccination dashboard through a single portal. It also provides a more targeted data about our city's vaccination progress by detailing rates of vaccination by community statistical area, or CSAs as we call them. Members of the public can access the new dashboard by visiting coronavirus.baltimorecity.gov. The dashboard is live as we speak here this morning. Baltimoreans have heard me say time and time again that our response to COVID-19 is based on data. That remains true. This dashboard overhaul will make it easier for residents and the members of the public to see exactly what Dr. Jaraja, our health experts, and I use to make calls that protect the health and safety of us all. I will now turn it over to Dr. Jaraja for our current metrics and a deeper look at the new data tool. Dr. D?
Good morning, and thank you, Mayor Scott, for your continued leadership. I'd like to begin by sharing some of the key indicators city leadership is tracking given the current phase of the coronavirus pandemic. We've taken feedback from residents, and in consultation with our epidemiologists, we are very excited about the launch of these new dashboards. These metrics, highlighted along with CDC guidance, will also help us determine when it is appropriate to lift the indoor mask mandate, or if necessary, reintroduce restrictions to help limit the spread of disease. We are now continuing to monitor the number of new cases, deaths, percent positivity, and new COVID-19 hospitalizations in Baltimore City, all via 7-day averages to account for daily swings in the data. That's this very first, or actually the first dashboard that you see here. So additionally, we're also tracking vaccination coverage and how it increases within our eligible population, which at this time includes everyone over the age of 12 here in the city. This update to the dashboard also aligns with the CDC's COVID data tracker, which looks at the same metrics over a 7-day period to determine the level of community transmission within a jurisdiction. Additionally, you will notice that our key indicators trends are based on 2-week intervals to better illustrate rapid changes in the data. As of yesterday, as you can see, Baltimore City is averaging almost 85 cases per day, an increase of 8.6% from 2 weeks ago. Our positivity is 2.4%, a decrease of 23% from 2 weeks ago. We've seen 138 COVID-19 hospitalizations in the past 2 weeks. And to date, 56,649 city residents have tested positive for COVID-19. As of yesterday, 1,156 residents have tragically lost their lives due to this disease, with the number of fatalities increasing by 25% in the last 2 weeks. Based on the data, per CDC's definition, Baltimore remains in the substantial community transmission category. The Baltimore City Health Department and our clinical partners continue to provide vaccines for residents, meeting individuals and families where they are with mobile vaccination clinics in areas of low vaccination coverage. Currently, 64.2% of eligible residents aged 12 and up have received their first or single dose of vaccine, and 56.9% of eligible residents are fully vaccinated. In addition to the updates on the dashboard of key COVID metrics, our epidemiologists have also updated our COVID vaccine coverage map to now detail rates of vaccination across the city via CSA. This data is what helps to guide our mobile vaccination clinics. This new map is also available at coronavirus.baltimorecity.gov. One of the key features of this update includes the ability to overlay mobile vaccination clinics held by the Health Department, our partners, as well as the Maryland Department of Health, as a way to connect people to needed resources. As a reminder, the Health Department provides updates to its weekly vaccination schedule at baltimorecity.gov 443-984-8650/BeMoreVax. Individuals without access to the internet can call 443-984-8650 to talk with a representative from our COVID call center who can provide information about where to receive a vaccine. Likewise, if someone has trouble leaving their home, they can register with our Vax at Home program to have vaccines brought to them and their caregivers, either by calling the same number or registering at covax.baltimorecity.gov. As a reminder, the prevalence of the highly transmissible Delta variant required Baltimore City to reinstate its indoor mask order on August 9th. As I stated earlier, the CDC has indicated that the city continues to experience substantial community transmission rates, and we will maintain our mask mandate until we begin seeing the city turn the cove on these key metrics. Now that even fully vaccinated individuals who get COVID can spread the virus as easily as unvaccinated individuals, it remains vital that all residents, regardless of immunization status, continue to practice harm reduction principles to reduce the rates of community transmission. Remember to wear your mask, wash your hands, keep your distance, and if you have any symptoms or exposure to someone with symptoms, get tested, even if you're fully vaccinated. The health department also provides mobile testing at sites across the city. This information can be found at coronavirus.baltimorecity.gov/testing. In the last few weeks, the FDA has approved additional doses to those who received a 2-dose vaccine and are moderate to severely immunocompromised. During that same time period, the Department of Health and Human Services announced plans to begin providing booster shots in the fall, subject to the final approval of the FDA. While recently there have been announcements regarding the availability of booster doses, at this time, I would like to remind residents that the Health Department continues to follow the science and direction of the FDA and CDC. Currently, an additional COVID-19 dose for the general public, including older adults, has not yet been authorized by the FDA or recommended by the CDC. The Health Department does not recommend off-label use of the COVID-19 vaccine and will not be administering booster doses until there's full approval from the FDA and the Advisory Committee on Immunization Practices. We encourage residents to please be patient and to wait until we make announcements regarding the availability of booster doses. We will be making more announcements on the locations and steps residents should take once these booster doses are fully approved. Currently, an additional COVID-19 mRNA dose is authorized by the FDA for individuals with moderate to severe immunocompromising medical conditions, and this is to occur at least 28 days after their second shot. The Health Department is providing additional doses for those individuals that meet these criteria at many of our mobile response locations. Some, but not all of our clinics and pharmacy locations are able to provide those doses. I strongly encourage those individuals who are immunocompromised to call our call center at 443-984-8650 anytime Monday through Friday from 8 a.m. to 6 p.m. and Saturdays from 9 to 1 p.m. for an update list of everyone who's offering those additional doses. We recommend residents who believe they may qualify for that additional dose to speak with their medical provider. The Health Department will not require a doctor's note, but will need to see proof of someone being fully vaccinated, either through a physical vaccine card or digital vaccine card. For that card, you can visit myirmobile.com for assistance in getting your online vaccination record. Please remember to wear your mask over your nose and mouth when indoors, wash your hands, keep your distance, and if you have any symptoms or exposure to someone with symptoms, please get tested, even if you're fully vaccinated. Thank you.
Thank you, Dr. Duranza. And as you heard our health commissioner mention, 64.2% of our city has had at least one dose of vaccination, and that number continues to grow. But we know that we would not be at this point without the help of not only our community partners, but our other city agencies as well. The Baltimore City Fire Department has been a major force in our vaccination efforts as they work directly with our health department to vaccinate residents in their homes. We have vaccinated more than 350 people through in-home vaccination. As a reminder, you can call 443-984-8650 to schedule an in-home vaccination appointment. That's again 443-984-8650. This is what an accessible and equitable COVID-19 response looks like, and I'm grateful to Chief Ford and the women and men of the fire department for the role they have played in protecting our residents. Chief Ford?
Thank you, Mayor, for your leadership and public safety and health throughout the city. Thank you, Dr. Jaraza, for your leadership in trying to keep our community safe. I also want to thank members of our department, in particular, Deputy Chief Matz, Paramedic Latonia Everett, and Lieutenant Johnson, those two who were particularly boots on the ground in this issue. Since May 11th, we partnered with the City of Baltimore, the Health Department, and the University of Maryland Medical Center to offer free COVID vaccinations to residents in their homes. This is a wonderful opportunity to ensure that those who are unable to get out of their homes, whether it's from lack of transportation or mobility, our goal is to make receiving the vaccination as convenient as possible. And since the inception, we have administered 347 vaccines to residents in the comfort of their own homes, in support of Mayor Scott's goal to have everyone in the city of Baltimore vaccinated. We will continue our efforts until we've connected with everyone who is interested in receiving the vaccine. The opportunity is still available. I know that we've said this several times, but I believe repetition is good for the soul. In order to register, please call 443-984-8650. Again, that number is 443-984-8650. Or you can register online at covax.baltimorecity.gov. Again, that's covax.baltimorecity.gov. Thank you, Mayor.
Thank you, Chief. And before we wrap up and take questions, I'm excited today to announce a vaccination incentive that no true Baltimorean can pass up. As we said earlier, we know football is back, with us taking on the Los Reno, whatever they're called, on Monday night. And let me just say, if you're not understanding that our Ravens will be continuing in the Super Bowl this year, you can no longer reside in the city of Baltimore. But I have teamed up with the health department for a contest to win 2 tickets to my skybox at M&T Bank Stadium for the Ravens game against the Chiefs on Sunday night when Patrick Mahomes comes to town. And entry is easy. Just head to one of our vaccination clinics, snap a selfie in front of our health department's banner, tag at Be More Healthy on Instagram, Twitter, or Facebook using the hashtag #BeMoreVax, and entries will be accepted until Friday, September 17th, and the winner will be contacted via direct message. We will be doing this for every home game throughout the season. And of course, winners must show proof of vaccination and residency in Baltimore City to be a winner. So, let's show some pride and love for our Ravens and love for each other by getting vaccinated and entering into the contest. And with that, we'll take a few questions. Kate?
Oh, I thought that without my glasses. Hi, happy Friday, Mayor Scott.
Happy Friday.
I have a question about the city's vaccination requirement for Baltimore City employees. Given President Biden's aggressive new mandate for the executive branch, where he is eliminating the testing opt-out, either you get the vaccine or you get disciplined, have you rethought the fact that the city's current protocol not only includes opt-outs for the vaccination, but includes religious and medical exemptions to the testing? Are you reconsidering that at all?
We are continuing down the path that we set forth, and we will make adjustments as the data drives us after going through with our original plan.
Just to follow up, so I guess that's a no. But what are you looking for, or what are you waiting for? I think it's the allowing an exemption to the testing part, which was which was an opt-out to begin with. I'm hoping that you could explain the data behind that, why that's in place right now for city
Well, I
employees.
think we know that we have protections for religious reasons in this country, and this is no different. And what we're going to continue to do, Kate, is this is about us working with our employees, with our partners in labor, with the health commissioner, with our HR director to make sure that we're getting more of our employees vaccinated. As we said when we announced this last week, we're going to use the data to drive how we go further and if we need to go further, but we are not without going through, right? Without going through with the word that I committed to and the word that the health commissioner committed to. We're not going to change that right now.
Okay. And finally, I have a question for Dr. Duraza. I'm just curious, you have said for the last several weeks, we now know that vaccinated people can spread the virus as easily as unvaccinated people. Are you referring to that recent piece in JAMA, or is there some other research or data that you're referring to? It would just be helpful to underscore that if I could do that with data. Thanks.
Sure, sure. So again, referring to much of what the CDC has put out. So they put out MMWR, we call MMWR reports on a weekly basis, multiple reports. So based on the data that the CDC has compiled, that they have seen that transmission is just as likely, unfortunately, with the vaccinated and unvaccinated.
Thank you.
Sir?
Good morning.
Good morning.
Talking in terms of the immunocompromised being eligible for boosters, but I didn't hear any reference to anyone else. How does that go with the governors now opening this up to congregate living facilities and nursing homes, et cetera?
Sure, sure. So the booster doses for the general population have not yet been approved by the FDA as well as the ACIP, which is the CDC's Advisory Committee on Immunization Practices. So though there has been discussion, there has not been full approval yet. And so if something's not yet fully approved, it's considered to be an off-label use. And again, we'd like to wait until we see full approval from the FDA and the ACIP before opening it up to the general population. But as you note, it is available for those that are severely or moderately immunocompromised.
So just to make sure I'm clear, if there's a nursing home or assisted living facility within the city limits, are those people eligible for a booster under the state's guidance, or are you prohibiting it within the city limits?
We're not prohibiting it, but we do run vaccination clinics and we provide vaccinations across the city. So our vaccination sites, again, are not going to be doing any off-label use of vaccines at this point.
But the state may do that, if they so choose. One last question. Lily Mae Jackson was listed among 3 schools recently that I think had 16 cases in young children, younger than 10. When the schools come out, do they have numbers they report to you? Do we have a way of gauging as school gets up and running where we're seeing pockets and what kind of testing or different things are going on to try to help with that?
Yeah, I'll let Dr. Duraza come up in a second, but Dr. Duraza and myself are always in constant communication with them. Dr. Duraza has been working with the school system on their protocols and practices that they have in place and how that data is collected in the testing, and I'll let her go further on that.
So every positive test in the city resident is always reported to the health department. We have specific contact tracing teams that are focused on schools. We know that city schools have been doing what's called surveillance testing, where they test people weekly, symptomatic or not. And in that surveillance testing, they may identify someone who did not have symptoms and recommend that that pod close and that that individual be tested. And so, we anticipate, because we're sometimes testing people who, again, have no symptoms at all, that you may catch some cases that were asymptomatic. But again, all positive cases are always reported to the health department.
Thank you.
Thank you, ma'am.
Good morning, Mayor Scott.
Good morning.
Going back to schools for a second, we know that Project Baltimore investigated some of the allegations in Augusta Fells. City schools confirmed those allegations and more. Given what the public has learned and you as mayor, do you plan to hold any sort of investigative hearing in the public to learn what exactly is going on across Baltimore City public schools?
So I'm aware of the report. We know that our system has been challenged. We know, again, that The state of Maryland has admitted that it underfunded our city schools to the tune of $300 million a year for many, many years, and we cannot ignore that, especially with the efforts that the state legislature has taken to override a short-sighted veto of the governor to fully fund public schools in Maryland. Under my administration, what we will do is to continue to make sure that our students and their education come first, and that we are building a 21st century system by working hand in hand with the school system, with our partners at the state who have the direct influence over education, to build the blueprint for Maryland's future as the law designed. That's what we're going to do each and every day. We will not use this as an opportunity to just poo-poo on our students.
But yes or no, you as mayor, will you call for a hearing and use your platform to get to the bottom of this?
Well, again, I think that we have to help you guys understand how government works. Mayors don't call public hearings. The legislature does that. And also understand, again, that this report was conducted by the school system on their own, without anyone from your station or others dictating to them. We know what happened. There are processes and practice in place to deal with those people and to make sure they are audited. Baltimore City Schools is audited by the state of Maryland consistently, and they've had good audits recently. I would encourage you guys to go read them so that we will continue to make sure that this doesn't happen again. We can do that by building systems in place to make sure that not only do we have these fail-safes like they had in this case, because this was caught by the school system and no one else, but they will also build in systems that don't allow for it to happen in the first place. Thank you.
Do you think that report would have come out if it wouldn't have been for the investigation and the reporting that Project Baltimore has done, though?
Well, the reality is that the report was done, and the adjustments and the necessary actions were taken regardless of Project Baltimore, right? They had already done that work. The people were already disciplined. That stuff happened without the report coming out in the public. The real reality and the real thing that we have to understand is, was action taken regardless? Action was taken. More actions are to come. That's the bottom line. Emily?
Good afternoon. I'd like to ask more about the at-home vaccination clinic. I know Chief Ford touched briefly on the reasons why folks need access at home, but if we could hear more about them and specific reasons, it'd be helpful for my audience.
Yeah, I think that when you think about folks who can't physically leave their homes, right? Residents in Baltimore who are homebound, we know that they'll have people coming into their homes, working with them. Their families will be visiting them, right? They deserve the right to be vaccinated too. They deserve the right to be able to have that same access to the vaccine, and that's what this program is about. And I'll let Dr. Duraza and Chief Ford go into more, but this is about equitable access for people who need to be protected from this deadly virus like everyone else.
I'm going to also make an assist on this and pass the ball to Claytonia Everett, who is the paramedic that actually is out there going house to house.
Good morning. My name is Claytonia Everett. I'm sorry, I didn't hear your question.
Thank you for speaking. I was asking why specifically folks are signing up for this program. If you could share some of the reasons and stories you've heard in your work.
Well, most of the reason is because they are homebound. Most of our patients are unable to do anything, and with their caregivers, they're unable to come out as well. So these people actually need someone to come in and give them help. So when we go in there, we see that this is very necessary and very important, because COVID has been going on now for over a year, and these people haven't had visitors because they're not vaccinated. So this is important, because if they're home and it's been over a year and then their family can't visit, then this is something that they really want.
Thank you.
Thank you. Go ahead, Kate.
I just have one more question. One more question in relation to the president's announcement yesterday. He talked a lot about testing and invoking the Defense Production Act, and he's got to boost supply. And I'm wondering, this might be a question for you, Dr. D. Are you seeing or tracking an increase in demand in testing? We know it's happening at the convention center site. Are you noticing or experiencing a delay in getting the results back or any sort of supply or procurement issues?
Sure. So no direct supplier procurement issues. Test turnaround time is specific to each site. We continue to travel weekly to different sites to perform testing, especially in areas where we know that there's less access or where we see lower vaccination rates. But there are multiple sites across the city. We're one of many partners who are testing, and we've absolutely seen the demand increase.
But no, just to make sure residents aren't worried that there isn't enough, that it's not going to return to what we saw in the spring. At this point, you're seeing an increase, but you've got the supply.
We're seeing an increase, and I think, again, the system can absorb that increase. Again, we had seen testing go down significantly, and so I think it's just a matter of kind of ramping back up to where we were in the spring.
Thank you. Thanks.
Thank you.